Welcome to First Issues. Long gone are the days when artificial intelligence or AI was only a thing of science fiction movies. Today, we hear about it in the corporate world where day-to-day operations are automated using AI. Scholars use AI tools to help with their assignments, and primary school kids learn about it in their science classes, so it is practically everywhere. But one place that maybe was not as commonplace for AI is healthcare. Without a doubt, in the last few years, artificial intelligence has become a transformational force in healthcare, bolstering medical research, care delivery, and health system operations. Reports show that artificial intelligence simplifies the lives of patients, doctors, and hospital administrators by performing tasks that are typically done by humans in less time and at a fraction of the cost. Of course, with all these benefits comes the need to fully understand and grasp why AI should be the standard in every healthcare center. This speaks to both the pros and cons of having AI tools and technologies. We have this conversation with pharmacologist and consultant cardiologist, Dr. Kiran Bhagat. Doctor, thank you so much for coming on First Issues and affording us your time. We're here today to talk about the impact of AI on the healthcare industry. Let us start there. What impacts are we seeing?
Well, artificial intelligence, there are a number of words people use. They use ChatGPT, they use Gemini, they use augmented intelligence. They're all pretty much, as doctors, we see them as artificial intelligence. And the answer in simple terms is artificial intelligence in medicine is everywhere now. The interface between healthcare and artificial intelligence is something that we are going to see increasingly, and those doctors that get left behind are really going to get left behind in the sense that artificial intelligence, or I like to call it augmented intelligence, in the sense that it's going to augment what we do already in every branch of medicine.
You were just talking about doctors getting left behind if they don't, immerse themselves in this new revolution. But what are the challenges aside from that may present with AI in the healthcare industry?
So the problem with artificial intelligence is that of security in terms of data protection. These are people's x-rays going in, for example. There is personal data going in there. And there's always a fear of the breach of information. If somebody leaks information about a chest x-ray that belonged to a patient who perhaps died or something or other. So the issue of breach of personal privacy is an issue that we need to tackle globally in terms of how we use that data, because artificial intelligence is based on data and we need to get that data from patients. And so it's a very delicate balance that we face, an ethical balance, if you like, is how much data can we share and how can we make this data anonymous. We know, for example, that similarly the challenges we face with artificial intelligence in the field of dermatology. We know that the majority of the data that is fed into artificial intelligence is based on white Caucasian populations. So, people like you and me, if we have the same skin rash, the artificial intelligence machine doesn't have enough information to detect what type of rash this is, because it's been fed, if you like, for want of a better word, white data. So we need to actually make sure that it's unbiased, it's data protection provided, and we need to be careful about the interpretations that it can make, which may look very intelligent when it spits out this information, but it's based on everything that you fed it.
With everything that we introduced, or the revolutions that have been, that we have experienced, it was to better improve or better the human experience, right? So what improvements for the human experience are likely to be seen with AI being introduced in healthcare?
It's vast, and I'm a great proponent of the role of AI or artificial intelligence in medicine. We can take a number of specialties for those that are doubting Thomases that are listening out there, I remember the days as old as I am where during an exam you were not allowed to use a calculator because you had to use your mind, or In the old days, they used to use something called a slide rule, which worked out calculations. Now these are given to students because we expect them to use a calculator, and the same with Google. People are now Googling. Previously it was forbidden to do a spell check. Now, you'd think it's laughable not to do a spell check or a grammar check. So it's the same with artificial intelligence. It's going to come to the stage where it's almost like it may be brought up in a court of law to say to the doctor, if something has gone wrong, why didn't you consult artificial intelligence? So that's the extent in which it's going to be involved. If we take a number of specialties, the one that comes to mind immediately is that of radiology. Radiology is the practice of looking at images, whether it's an MRI scan, whether it's a CT scan, whether it's an X-ray or an ultrasound. Now you can imagine this is all data. It's data that is fed in of millions of X-rays or millions of CT scans or millions of MRI scans or ultrasound scans. And the data that is fed in will allow the computer to pick up diseases within a chest or a CT scan of the brain much, much earlier than and quicker than a radiologist. A radiologist can work so many hours and then gets tired, and we know that when the brain gets tired you miss things. A machine never gets tired, and you can apply these client data overnight. The machine will work overnight and churn out the diagnosis in a much faster, more efficient and perhaps more accurate means than a radiologist.